Hi everyone, my name is Katrina Lobs, and today I will be presenting on a patient case study. For this case study, we will be focusing on childhood obesity. Our patient today is a 14-year-old female, and her name is Jane. I will be talking about some nutritional and physical activity recommendations, some labs and backgrounds on this patient, and give a sample menu, talk about her food diary, and some other things as well. So currently we are seeing the highest rates of childhood obesity in this country as of today. 18.5% of children in America are actually obese, and this number is very alarming for a number of reasons. For one, overweight and obese children are very likely to develop diseases like diabetes, cardiovascular disease, high blood pressure, and high cholesterol at a very young age. Childhood obesity can also lead to depression and low self-esteem, which in turn can lead to poor academic success. So like I said before, our patient's name is Jane. She is a 14-year-old female, and Jane's weight has been increasing at a rate of 10 to 15 pounds per year for 6 years. Jane, she lives at home with her mom and dad and two of her siblings. Both of her parents are obese. Her father has type 2 diabetes, and her mother has hyperlipidemia. Jane's parents also report that they often run out of money for food before the end of the month, which means they often turn to fast food for dinner most of the time. Both of her parents also work outside of the house, which creates a time constraint, which again is another reason why they turn to fast food a lot of the time. And because of this, like I said, her family and a lot of other families, because of the time constraint and, the issue with the low income, a lot of families nowadays in America are eating a lot of fast food, unfortunately. Jane does go to school and participates in physical activity 2 times per week, but when she does get home, she often watches TV or plays with her friends after school. Jane does eat lunch at school, but she eats her breakfast at home. So her physical assessment, Jane's review of symptoms are unremarkable. Her physical exam reveals an obese appearing 14-year-old female. Her heart sounds are normal, and she is alert and oriented times 3. There is no note of edema, and she is 62 inches or 5 foot 2 inches. She weighs around 152.9 pounds. Her blood pressure is high at 125/82. She also has some abnormal labs to note. Her fasting glucose reads at 116, and the normal range is 95 to 100, so a little over the normal range. Her hemoglobin A1C, which is a 3-month average of her glucose reading, her A1C reads at 5.5, and the normal range is at 3.9 to 5.2, so again a little over. Her LDL, which is known as good cholesterol, should be above 45, but Jane's is at 36. And her LDL cholesterol, which is known as the bad cholesterol, should be lower than 110, and Jane's is at 113. So there are many obesity risk factors, but I'm just going to talk about a few of them today. So genetics definitely plays a role in obesity. It has been found that BMI is 25 to 40% heritable, but often needs to be coupled with contributing environmental and behavioral factors. So some genetic factors that Jane possesses that contribute to her obesity are her parents are actually obese. So this automatically makes her more predisposed to being obese because of this fact. Her father also has a history of prediabetes, and it was noted that Jane's A1C is above the normal range. It was also noted that her fasting glucose was high as well. This makes her more predisposed to diabetes. it didn't note that she has prediabetes, but she could certainly be tested for it, and it looks very likely that she could have prediabetes at this point. Her mother also has hyperlipidemia, and Jane's cholesterol labs are also abnormal, meaning that she also could have hyperlipidemia at this point. Some environmental factors that play a part in Jane's obesity are her large calorie intakes. Jane eats a large portion, as seen in her food diary. So, for example, on day 1, she had 2 slices of pizza with a large cookie, and some chocolate milk for lunch. So, instead of having the 2 slices, she could have maybe only had 1 and replaced that large cookie with maybe an apple or some fruit and still have been just as satisfied. And she also eats a lot of fast foods, which is loaded with excess sodium, fats, and added sugars. And because Jane doesn't get much exercise, all of those added sugars that she is eating are not burned off very easily, and it's definitely stored as fat, which is contributing to her high BMI and obesity. So Jane is not very physically active, like I just mentioned. She's only getting 2 days of physical activity at school, and all the while she watches a lot of TV after school instead of getting outside and getting some exercise. And then in addition, her family has a low income, meaning they rely on fast foods and processed foods to feed their family, which tends to not be very healthy at times. So some nutritional recommendations that I have for Jane. Her ideal body weight is 105 to 110 pounds based off of her height of 62 inches. So I recommend that Jane lose about 1 to 2 pounds per week by reducing her calories by 500 calories per day. So in total, I recommend Jane eat around 1,400 calories per day with 6 servings of whole grains, 3 to 4 servings of vegetables, 4 servings of fruits, 2 to 3 servings of low-fat milk and milk products, and 3 to 4 servings of lean meats per day. I'm also recommending 1 serving of fats and oils daily, as well as 3 ounces of sweets and sugars per week. Some activity recommendations that I have for Jane, in addition to her nutritional recommendations, are that she get more exercise. So in order to lose weight, Jane must exercise at least 60 minutes per day, at least 5 to 6 days per week. So some ways that she can accomplish this is if she's close enough to school, maybe she can ride her bike or walk to school. She can help her parents out around the house with some chores. Maybe she can play in the garden and, learn how to cook or, help out in the garden just to burn some extra calories. Or, of course, instead of going home and watching TV, just getting outside a little bit after school and just getting active. So here I have day 1 of her sample diary that I'm recommending for Jane. So you can see for breakfast, I'm recommending, a 1 ounce granola bar with 8 ounces of low-fat yogurt, a half a cup of strawberries and some blueberries as a snack, some crackers and some carrots with that. Lunch is a turkey sandwich on some whole wheat bread with some mayo and lettuce, and also some broccoli to go with that with some low-fat milk. As a snack, some cottage cheese and a banana, and she can certainly switch that out with any other fruit that she would like. And then dinner is some rice, some grilled chicken, and then a little salad on the side. Day 2. For breakfast, I have recommended a cup of cantaloupe, or again, really any other fruit that she would like. 2 scrambled eggs with a whole wheat English muffin. As a snack, some granola with a 1/4 cup of fat-free milk. Some lunch, again, some milk, and then a peanut butter and jelly sandwich on some whole wheat bread. But again, just watching the portion sizes of that peanut butter and jelly because there can be a lot of added sugars in that. Some celery and then some baby carrots on the side. For dinner, we're going to have a little side salad and then whole wheat spaghetti with some tomato sauce and a little bit of cheese. And then dessert, some ginger snaps. And then day 3, some fat-free milk with some strawberries and again an English muffin. As a snack, we have some graham crackers and then some chocolate milk. Lunch is, as you can see, just a salad with a bunch of veggies in it and then a small amount of dressing. Dinner, we have some pasta with some broccoli and chicken in it. And then dessert is a frozen fruit bar. So because Jane's family, they do need some assistance because they do have a low income and they're resorting to fast foods. There's some food assistance programs made for that. There are some food assistance programs that can be beneficial for Jane's family. Is a supplemental nutritional assistance program, or it's also called SNAP. So this program provides foods to low-income families. It can also provide education about healthy eating, and it can help Jane learn about cooking so she can help with the garden or help her parents cook to save some time. Since her parents do work and they get home late. Another program that Jane's family can take advantage of is the National School Lunch Program. And this program provides free or reduced lunches to children with low income. And since Jane eats lunch at school, this can be really beneficial for them. So in conclusion, if Jane can make these nutritional and physical activity recommendations, she can absolutely make her weight loss goal of 1 to 2 pounds per week with a little bit of willpower and determination. And here I have some references that I used for this presentation. Okay, thank you.